I'm super excited to welcome Nurse Alice Benjamin. Nurse Alice, how are you today?
I'm doing well. Thank you for having me.
Awesome. If you guys don't know who Nurse Alice is, Alice has been a healthcare professional for over 25 years. She is a nurse, MSN, ACNS, BC, a family nurse practitioner. She has experience covering cardiovascular care, critical care, emergency medicine, advanced practice nursing. She has really been focused on like hospital patient safety, critical care education, and clinical mentor to tons of nurses out there over the years. But really, what gets me excited about what Nurse Alice has been doing is her focus in social media and putting her expertise out there. If you haven't heard of her website, asknursealice.com. It's a trusted health and wellness resource. And MediaRx is a media training firm for healthcare professionals. Her work as a TV medical correspondent and podcast host has made her a go-to expert in translating complex medical topics into relatable, actionable insights for patients and healthcare professionals alike. One of the things I'm really excited about her mantra is like, I like to talk to people before they became my patients. And that is so key. So Nurse Alice, thank you so much for joining us today.
Thanks for having me. You know, when I hear an introduction, I'm like, oh my gosh, is that me? But you know what, when you're passionate about the work that you do, you just don't even think of those things. You just go, go, go. So yeah, I'm excited to be here. Thanks for having me.
You kind of mentioned a little bit like being on social media, right? And sharing your expertise. You said some of your colleagues are resistant to that. Some of the doctors I talk on this or healthcare professionals have a huge media presence, some not at all. But I'm just curious, what are your thoughts about like, what does that mean to be out there as a health professional in the social media setting? You know, how do you, if someone's just dipping their toe, like we talked to a lot of healthcare professionals, what do you recommend to them? I'm sure they would ask you for advice. What do you recommend to them if they're just getting started to put themselves out there on social media and share their expertise?
Right. Well, I think everyone first shares the passion of wanting to educate their patients and the public, right? We all want patients to do well. When you get into media, it gets a little bit tricky, right? Because we're all concerned about that one soundbite where you didn't say something correctly and it goes viral. And also, and this is a very slippery slope. So I will say this, just as much as you've trained to become a physician, nurse practitioner, midwife, there are elements, because of all that knowledge and training you have, it's important that we can articulate this properly. Now, in a setting where it's recorded or you may not have as much control of how far the message goes, it's very important to make sure you're as prepared as possible. So I always encourage people, you got to do an in-service. You got to do some classes, something. I mean, as eloquent as you can speak in an academic symposium, that's one thing. But when you're in social media space, the public can be less forgiving because there's an element of this where, because we've not established a patient-provider relationship, this is informational use only, education purpose only. Now, we know that healthcare is not entertainment, but in that setting, because there's no relationship, it is. It's just, so I always make sure when I'm talking about whether it's heart disease, weight loss, diabetes, I will speak about it generally, maybe reference HIPAA-compliant of some things that I commonly see in practice, but I'll always say, but make sure you follow up with your healthcare provider. So there's some staple things that you should do, but for people who don't know, I always encourage them, take a workshop, take a class on how to become more savvy in social media, or whether that's in writing, because, you have like your popular, I know they're your academic journals, but you have like your Essence magazine, your Ebony, your Black Enterprise, and other Huffington Post. You can write for those as well, as I consider that media. And then there's television, radio, and podcasts, which, by the way, Theo, is exactly why I came up with the MediaRx.com. It is a mass communications platform that actually provides PR and media training for healthcare professionals, because we walk a very fine line and we have to make sure that we're seen as objective and what we're saying is evidence-based, and that we're delivering very succinct bullet points in a short amount of time. So it takes practice. So I would say in-service, get some education. Hey, come to MediaRx.com, get some training, and then you just got to do it. You got to get in front of your phone and just practice and just get it out there. But I would encourage people to do it, because if you don't do it, you're going to get left behind, because this is how our patients are getting information. They would go online and Google things, which they still do, but they're going to TikTok, they're going to Instagram, and they're looking at the people talking to them, because that's what they want. They want someone to talk to them, explain something to them. So when we don't have that time in the office or during our visits, people are going here to social media and getting a kind of a continuation of information. So providers should do it. Hospitals get on board. There's some policies and some guidelines when it comes to hospital brands and things like that. So just make sure you check with your hospital facility policy, get some training, and just get out there.
Absolutely. I mean, you hit the nail on the head. I mean, obviously during COVID, there was a lot of misinformation going out there. And so, I think healthcare professionals got to realize you're the expert. The expertise is there. And so, I think it starts with the intention. If your intention is to do no harm, right?
Mhm.
Then go out there and start, like you said, baby steps, right? So that's one thing. And to your point, get the training you need. Like you mentioned, Media RX, definitely. We'll put a link in the show notes, but I absolutely encourage anyone, especially healthcare professionals, to kind of do that because this is the new way. We're seeing the advent of, we didn't really talk about too much on this pod, but we've talked in previous podcasts about AI, artificial intelligence. It's taking all this information and kind of remixing it. And so you want to make sure if you're out there communicating, you have the right information. But more importantly, you're making sure that if the AI is searching for quality information, you're going to find out searches are no longer using, Google searches. They're using AI and that they're sourcing it from your content potentially. And so things like that is becoming more and more important as we look at where, healthcare is going. And obviously misinformation and changes, having someone who kind of knows what they're speaking about will eventually bubble up. I think what's that saying? It says a lie goes around the world twice before the truth even puts its shoes on, right? And so
Right.
eventually truth will pop up, but like to your
Yeah.
point, just being consistent and be dedicated and have an intentionality around it. And I like your quote. Your quote was spot on. I like to talk to people before they become my patients. And I
I do.
think that is so key. I don't know if you know Dr. Jane Morgan. She was on this podcast. She did like the Stairwell Chronicles where she spoke about, just from her stairwell, talking about, things to do to help during COVID, right? To kind of, stay helpful. Dr. Refi, he was a pulmonologist. He did some breathing exercises people can do right during COVID to help them. And so, we're seeing more and more healthcare professionals putting their expertise out there, helping patients before they become their patients. And I think that's super, super great. Today, Dr. Ansari is going to talk to us a little bit about something very interesting. Social media, right?
Mhm.
Pandemic obviously exploded and a lot of doctors, which is necessary because there was a lot of misinformation going on during that time period. A lot of doctors became influencer and kind of communicated the expertise in this area. I talked to a nephrologist not too long ago. His post on how to breathe better and understanding if you have some COVID with some breathing exercises went viral. And so talk to me a little bit about the importance of getting out there. Number one, what made you get out there? Number two, how are you seeing the explosion in your business by putting yourself out there in social media?
Yeah, so definitely wasn't something I was trained in med school to do, right? That kind of business aspect of thing or the social aspect of finding new patients. But I think that's just the era that we're in right now. I think that patients really are on social media and there are some very legitimate resources on social media. Of course, you have to kind of weed through them. But I kind of knew that that was going to be a really strong marketing resource for me. And I was trying to just be as organic as possible with it to show patients kind of what they're going to get when they do actually become a patient of mine. And like you said, you get a few posts that do go viral and you end up getting more followers, and in turn, the more patients can see you and get exposed to you, I think that they become more interested in your practice. So I think it's just a valuable marketing tool. I think, of course, social media has lots of negative aspects, especially for young people, but you can kind of pick and choose your poison with social media. And I think if you do follow more positive accounts, you can improve your knowledge, improve your health as well.
Know, like, trust, right? They have to know who you are, what you're about, they have to like you, and then finally have to trust. And you can kind of do all that over time on social media because to your point, there's been literally not doctors, but maybe other consultants or other, business folks I watched over time before I was like, okay, this person is legitimate. I respect what they have to say. And we're pretty much, when we follow someone, we're saying, this is someone that I allow permission to influence me, right? Because
Right.
I trust what they say. And so to your point, even though you're in Southern California, the ability to kind of reach out and expand beyond that territory helps because you don't know, you can be helping someone in another state are moving, or maybe they know someone in Southern California and they're on the phone. I know Dr. Ansari's there. Why don't you go reach out to her? I love what she's talking about. And so you just don't know how all those interactions are happening behind the scenes, right? To impact your business, but also helping people no matter where they are. So I think that's important. Wow, this is great. I think you're doing some interesting things in the space, especially with your focus on direct primary care. I mean, I have stories of friends who went that route because they just couldn't get the help they needed, for special issues. They needed the time and space to kind of communicate their issues. Like one friend, she had a foot issue, couldn't solve it for a long time with her primary care through her insurance. She actually went through, I think she went through concierge though. And that doctor helped her, like you said, not just with the medications, but understanding lifestyle changes, understanding functional medicine, things like that, so that she could get the space she needed to get healed up, because she was just struggling for like years before she got her foot issue taken care of. So you definitely provide a valuable resource. Dr. Shirley, how are you today, Dr. Shirley?
Hi, thank you guys so much for having me. Today's been relatively very chill. I just came off of my clinic block, so perfect time to talk about all the things that we want to talk about today.
I would love to kind of just dig into a little bit about your journey in social media real quick. Talk about that, as a resident and putting your expertise out there. A lot of doctors are hesitant, right? Because, it's usually a one-to-one kind of expertise that you provide to patient, but now you're out there communicating to the world. And so people are probably asking questions outside of, areas that you may not be familiar with and things of that nature. So how did you navigate, number one, starting down this journey? And number two, what are your thoughts about the future of social media and how it can be used as a positive force?
It started off as like a tiny little mentorship page. If I'm being honest, I'm an international medical graduate from the Philippines. And so I lived half of my life in the Philippines, half of my life in the US. And what actually triggered me to actually come back here was not during the hype, but when COVID had hit, and all of my family was already here in the US, and my mom actually was just very, very nervous about the state of things, right? And she was just nervous that if I got COVID somewhere else, that things would go the opposite way, So that's how I kind of came over here. And navigating through, getting through the system, how do I, like, what exams do I take, what kind of, how do I get into residency, basically, how do I get through the system as an international graduate, was kind of the biggest hurdle that I ever had, trying to get in. And it's because not a lot of us have that direct mentorship that, of course, US schools would have, because technically that's the goal of US medical schools, is to get them into the US system, right? I was very fortunate because so I'm from Hawaii. I actually pronounce it Hawaii, but and there was this one doctor. His name was Dr. Sunito, who has a primary care clinic back there. And because of my mom's connections with one of the other providers, Dr. Go, and his wife, Dr. Tan, they were able to kind of pull me into this clinic where they were initially having me shadow and just kind of make sure that I wouldn't become dull with my clinical skills, basically. They were worried that if I wanted to go back to the Philippines, that I wouldn't have that clinical, the clinical skills would have been. So they're like, no, you should come over and just shadow. There are a lot of medical students or a lot of medical, international medical graduates as well, who are rotating in the clinic, trying to get a lot of US clinical experience so that they can try and, apply for residency. And that's kind of how my journey started. I was just there, and then I kind of graduated responsibilities until I was like, you know what? Everyone convinced me in the clinic that, you should just try to apply for residency here. And that's how my journey had started. By that time, I was already the preceptorship coordinator. So we had this whole preceptorship program where we had all these students, like medical students, all these pre-med students, and all these international graduates who were rotating with us. And that's kind of what my position was at that time. And I was just very heavily involved in helping, just, simple things like, okay, this is how we're going to write up your CV. This is how we're going to write up your personal statement. This is how, let me connect you with this doctor. Oh, you're interested in endocrinology. Let me hit you up with this. Just kind of being that conduit, until I realized, wait, I've always been passionate about mentorship, but then I realized, wow, I'm really passionate about helping others navigate through this, because I didn't have that help that I I didn't have that help initially, and just realizing and acknowledging the fact that I wouldn't be where I am today if I didn't have that. And that's where it started. So a lot of mentorship going on there, a lot of teaching. We would have lectures about primary care, just giving lectures on what the latest guidelines are to all these medical students and all these trainees. And then moving forward, when I graduated from the program and got into residency, I was like, what should I do now? Like, I can't just stop, I just can't stop helping people. So that's how the page came out. Initially, it was just like a very informative page. Like, hey, this is how you should. If you're interested in applying for residence here in the U.S., these are the steps. These are your tips. And then it kind of grew as I grew. I feel like with social media, it's so difficult to stay in a niche. It's so difficult to stay in like one little category, because as an individual, you're changing as well. So navigating through that and kind of figuring out, okay, what goes on the private and what goes on the public social media, right? So it's, okay, what's my intention? Always figuring out, okay, what is my intention with this post? Because I feel like it's so easy to get ego driven on social media when you scroll and then you get the likes and then you get the comments and then you refresh and then you refresh and then you refresh. And it always had to be, what is my purpose with this post? Okay, this post is about, it's inspirational. This one is kind of like it's like a gag post. This is kind of like to make a little joke. This post is for medical education. This post is for advice specifically to the international medical graduates or medical students even just applying for residency. And that's how I've started to build the page. So there's like a little blurb there about USMLE advice, how to navigate through interviews, how you should be applying for what residency programs to be applying for, what should you be looking for as an applicant. And then I have a little blurb as well, like, okay, now as an intern, because I became an intern after all of that. So advising as well, how to navigate through internship, how to excel in your presentations, what is a good way to stay efficient with chart reviewing in the morning. And then now, beyond internship, because now I'm done with that phase, I've kind of gotten the hang of that. Now I'm in this whole, okay, now as a senior resident, my purpose now is to be a leader on the team, to educate, make sure that my teammates are, learning, that I'm teaching my medical students. So now it's kind of three pronged at this point, where the third prong is just education. Sometimes I post a little, how do you read an x-ray? Or sometimes it's, how do I talk to my patients about their code status? So a lot of like the little skills here and there. And that's kind of how I've built the page. So it's grown with me as I've grown through this journey. Definitely, I've seen a lot of people who are also what we call medfluencers on social media, as well as, interestingly enough, in medical school, we were always taught about this as well. Like, how do you navigate being on social media and being a doctor? You want to have that perfect balance of, my patients can relate to me, but at the same time, my patients can rely on me. My patients take me seriously. I'm not doing anything that will ruin my credibility. So I feel like it's such a very, very difficult balance to find, which is why I said always having that separate social media here and there. Definitely my big no-nos are HIPAA violations. You should not be talking about patients at all. That's why I'm very, very cautious about how comfortable I feel talking about experiences, unless it's, past and it's not something that someone can identify. Like, no, she's talking about me. So being safe on that end as well. Medical education wise and medical information, it's just so easy to make up information nowadays. We see it all the time. Like, sometimes not even medfluencers, but you have sometimes business owners or people just on the web who propagate misinformation about certain medical things, which is very scary. Like, I think even before social media was a big thing, we would even see it. People would say, take all these herbal supplements, forget about your cancer treatments, and then you kind of see it go the wrong way. So definitely, I think social media is a double-edged sword. Educate your patients. Definitely, you want to be able to educate them, empower them, but not give out. You still have to have proper consultations, I believe. It's not like, oh, if you have this, you should do this. It's always important to have a discussion with your doctor. So that's why I feel like social media can be very scary, a very, very scary place to navigate through. And it's, especially as a doctor, you have to be very careful with what you say. And other people, and how you handle backlash as well. There will always be a group of people who do not 100% believe in the health system, or do not 100% believe in the medical advice, right? And it's just, again, just the balance of trying to figure out how much you want to be on social media, how much you want to not expose, how much of yourself do you want to show on social media, how much do you want to share, at what point is oversharing for you, what is your intention with every post you make, and then go from there. I think it's just making sure that you have all of those principles in line.
And you definitely got to build it from the foundation, right? To your point, what's your intention with trying that post? I had two different doctors, a nephrologist and a cardiologist. The cardiologist mentioned to me the reason why in our podcast, Dr. Isang, go check it out. But he mentioned the reason why he started his social media journey was because he kept answering the same questions. So to him, doing social media was kind of like FAQ, right? So patients or anyone had questions. He said, "Hey, I already talked about this, right?" I gave a deep dive on that. And so for him, it became a way to kind of lighten his load a little bit and also kind of help folks, right? And then I was talking to Dr. Refi talking about nephrology, and he became really involved because to your point, the misinformation is out there, especially during COVID time. And so he came up with, scenarios and opportunities on how people can breathe healthier, right, online, and understanding different things from a medical standpoint that makes sense. And so, yeah, I think you're right. You guys are considered experts, making sure you kind of meet those guidelines and tension, understanding your audience, no HIPAA violations, and then making sure, you stay focused on what's important and the value that you bring to the channel. And I think if you kind of keep those guidelines in mind, most doctors can be successful. So that's awesome. Today, I have Dr. Travis Batts. He is a cardiologist based out of San Antonio, Texas. How are you doing today, doctor?
I'm doing well. Thank you for having me.
One thing's that, COVID, social media, look, you're out there, you're promoting your expertise. A lot of doctors that we talk to are doing the same thing, and that's how we, integrate with them and communicate with them. But a lot of doctors that we talk to, they're kind of hesitant, right, to do that, right? What is some advice you would give some of the doctors that we talk to who are so busy with practice and doing the day-to-day that they don't see the importance of putting themselves out there with social media, or maybe they feel fearful because they don't want to say the wrong thing and have a HIPAA violation or anything like that? What are some of your thoughts, and how do you talk to doctors about if they're kind of dipping their toe in this? What should they do?
Well, no, great question. And again, that road to social media is different for everyone. I mean, if you can't tell, I've never met a camera that I didn't like, right? but part of that is because I know that messages have power. I know that there is power in content. I know that many times patients, and I'll say this, won't see doctors that look like me or that think like me or that have a shared mental model or a shared collective cultural context that allows them to say, okay, that's how he did it. Let me do it that way. And I think each provider has something to offer. Now, back during COVID, and I'll applaud both the Association of Black Cardiologists as well as the American College of Cardiology, there was this push to help physicians understand this concept of branding. We made the joke earlier when we were talking about the setup that they didn't teach you this in medical school. And you are right. They did not teach us about branding. They taught us how to provide healthcare. They taught us how to do medicine, for lack of a better term. But as healthcare and social media and various things have evolved, we have to meet patients where they are. So if I had just 3 quick things, so for that physician that is on the fence about how to integrate themselves into social media, I mean, I would almost say, go about it either with the 3 T's that Mr. Harvey just spoke of, right? Even if you don't want to put your face on camera, I mean, there are ways to, kind of read something, have images go across, and again, 30 seconds of that, sending it out. I mean, that, post something about blood pressure, post something about, for me, heart disease. If it's a month and it's your month for February, I am busy. I am locked in. We are booking out events in February now where I'll go speak, at a barbershop or at a church or various things like that. If you say, well, I don't have the camera, I don't have this, the best camera you have is the one you have on you. Most iPhones or Androids are good enough to where you hook them up, say what you need to say, post that out there. And trust me, that patients will embrace your transparency. They'll embrace your truth and they'll appreciate your time, right? That's a different T. Those were the 3, but I love that transparency and truth. They'll embrace those things. And what you'll find is that now you'll start to be a little bit more comfortable. Now you'll start to anticipate, like November is National Diabetes Awareness Month. So guess what content is coming out in a couple of weeks for me? We're going to have a discussion about diabetes, right? So align it. One thing that I say, and I'll let you hop on and guide, because I can talk about this all day. The one thing I tell providers or anyone that is looking to have a message and want that thing to last is link your likes, right? Not necessarily people liking, but the things that you like to do, try to link them in your message. For me, I love fitness, I love nutrition, I love healthcare, and I love cardiology. Moreover, I love my family. So a lot of the things that you'll see is me working out with my kids, or having a discussion with my daughter about recovery, or talking to my wife about complementary meals where my wife and family are not vegan, so they want steak, but I'll make a portobello mushroom steak. Is understanding that balance that exists. And so a lot of it is the things that you like, it's easier to talk about. They appear more natural, right? And so in that, just like this conversation with Mr. Harvey, he's brilliant. I love talking to smart people. So I'm enjoying this, and it's natural. Whatever, we want to do from a social media standpoint, we already have it. So what I would say is just press record and get out there.
I mean, and I think there's hesitation. Even folks who may not be doctors, just putting their expertise out there. But I'm just thinking back to Dr. Jane Morgan. I had an interview with her. She's a cardiologist out of Atlanta. She just did these Stairwell Chronicles where she talked during COVID of different things she can do. And that helped her to kind of get her message out there. Or Dr. Rifai, who was a nephrologist, he talked about breathing, what breathing techniques you can do, right, to kind of help you if you feel like you're suffering. And then Dr. Isang, who also was a cardiologist, really kind of saying his patients will kept asking the same questions over and over again. So he wanted to create a way in the space where you can kind of answer that in a video format. So to your point, I think it has to start with that intention and, getting through, not looking at yourself as the, hey, I'm out here just putting myself out there, but no, I'm putting myself out there to help someone. If you kind of stay with that focus, it makes creating that content easier. So no, thank you for that. But I'm super excited that I have a special guest today, Dr. Ogunbayo, intervention cardiologist. How are you doing today, Dr. Ogunbayo?
I'm doing great. How are you doing?
I'm doing wonderful. So thank you for joining us today. Yes, Dr. Ogunbayo is an interventional cardiologist, and he's dedicated to advancing patient care, and he's really focused on inspiring others in social media of hashtags be greater than average, and he demonstrates a unique blend of clinical experience with compassionate care. But yes, how did you get involved in that? We talked to a lot of physicians and a lot of doctors, inpatient setting, outpatient, and they're just hesitant, right? What made you decide to go out there and put your expertise out there to build a kind of a following, if you will, on your expertise?
Thank you very much for that question. I was just talking to a colleague today, and I said, we don't cure or treat ignorance with more ignorance. We don't bring light into darkness by taking our light away. The cure to darkness is light. And I'm from Nigeria originally, and I know what healthcare looks like back home. I know that a lot of people don't take good care of themselves because A, like you alluded to, they don't have access. And B, even if they did, they need to be able to recognize the symptoms and signs of diseases that they may have in order to get the care that they need. And so we need awareness. I think, there's a holy book that says, my people perish for lack of knowledge. And so, people want knowledge. People want to know. And there are people that go through, you see the world we are in now is a world of social media. We all use it. We all soak it all in. We're on TikTok, we're on Instagram and things like that. And most often than not, what we watch there is different skits that make us smile, make us happy, make us enjoy life, right?
Yeah.
So if you have that platform, why not use it to educate people? You know what? This is what you get, and this is how you feel when you're having a heart attack. And this is what to expect when your cholesterol is high. These are the few things you can do to reduce your cholesterol, to do this and do this and do that. I think that we as human beings, whether you're a doctor, a nurse, even if you're not in healthcare, we have something that somebody needs. I've been fortunate that the good Lord has blessed me to get the training that I have and to know what I know. And even if it's one person that can get the help they need by listening to the video or to a skit or something that we put out there, then that is one person that's been saved. And there's many testimonies, if I might use that word. I mean, a lady a few years ago was like, well, I just watched this stuff. My husband was having that symptom. He ended up getting a stent. His life was saved. And that is why we're out there. We need to get knowledge out there. Something like what you were doing. Someone is going to get on your page and watch your videos, and by that get inspired to do something to help their community, to do something to provide access to their mother or their father. Oh, I did not know that we could sit at home and the blood pressure can be taken and their weight can be taken, and they can tell you to increase your water pill and things like that because of what you do. And because of your presence and putting it out online, people can understand that there's hope. People can understand there's easier access, and people can appreciate it and use it to their benefit. Ultimately, their health gets better and the whole world gets to be a better place because we're out there.
I love it. I love it. Well, and we talk about this a lot in this podcast about getting out there as doctors talk to patients, or just doctors communicating. Look at the 3 T's, right? Talk about your testimony.
And if I might add, before I forget, sorry to cut you, there's hesitation in the medical community because we continue to see that as a professional community. I mean, it's the same internet, the same TikTok, the same Instagram that you have comedians, right?
Mm-hmm.
People that go there and talk stuff and all that. And so from the professional standpoint, we're like, I don't want to be a part of that. It's just for joke stars and people that, just out there just to talk nonsense. But I think we need to start changing our view on that you can have a knife. A knife can be used for bad things and can also be used for good things.
Yeah,
so the question is, how do you want to use your tool?
It's a tool. I mean, some tools can be good and some tools can be bad. It just depends on the person wielding it. And you hit the nail on the head. You can only fight darkness, which is misinformation on the internet. During COVID, we saw so much misinformation. People who were not certified as doctors communicate wrong information, and people got hurt. So to your point, I think coming in with intention into social media and putting yourself out there with the good intention, even though it may be awkward, maybe not what you're used to. You may even get some arrows sling your way with people comment. But to your point, you fight that light, right? You fight that darkness with your light. And I love that.
Sure.
And we always talk about, and I think I'm going to throw another T in there. You just brought this up to my mind. 3 T's are just communication, right? Tell a testimony, right? What's the importance of this? Tell your truth, and then also, share and be very transparent. And then, I think that helps to kind of keep patients engaged and trust you more and more over time. Hey, I hope you enjoyed that. Look, we have more content that can really help you accelerate your practice this year. We have tons of content that can cover all the different topics we discussed earlier. If you want to hear more, click to the right or to the left, and you'll get more content to understand how to best grow your practice.